This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Dr. Joseph Desanto, an addiction specialist with BioCorRx Inc., an addiction treatment solutions company targeting substance use and other related disorders. And Dr. Desanto, thanks for joining us here today on eHealth Radio.
Good morning, Eric. Thanks for having me.
And you're more than welcome, and good morning to you, and thanks for your time. So for starters, as we know, all we hear about is COVID-19. It certainly is the big issue this year and a life-changing event globally. How has COVID-19 exasperated the U.S. opioid crisis, looking at another problem?
Well, overall, it has not been good. For treatment possibilities, it's been excellent. It's opened up a world of possibilities for people all around the country to have access to doctors that weren't necessarily in their area. But when it comes to overall, I guess we call mortality, morbidity, it's been bad. And the predicted opioid overdose death rates for this year have been higher than the last 2 years put together. And that's the predictions that they're making. We won't know until about March or April.
Yeah, really not surprised to hear that input there. And on the upside, the opportunities have really risen in being able to help people with the opioid problem. Now, what added factors may cause addicts to relapse during the pandemic?
Well, you picture everybody at home by themselves, alone. Not the best place in the world for an addict to be is by themselves. And it's typically what we do in our disease is that we isolate. Now, given the green flag to do that, that's opening up again another world of possibilities for the addict themselves. So they have a tendency to isolate to begin with, and to get them to socialize is part of the healing process, part of the sobriety process. And when that's not available to them, or when that's cut off from them, it's extremely difficult for them to reintegrate into society, which is probably the most important thing about getting an addict back to living, back out of their addiction. They're just not given the opportunity this year.
Yeah, and that certainly is an understatement, unfortunately. Now, looking at telehealth, how has Telehealth Helps serve the addiction recovery community, and can you tell us how BioCorRx uses telehealth in these regards?
Telehealth can be used by any doctor at any time now. The president's opened up and reduced the restrictions for our ability to speak with anybody across state lines, which wasn't possible before, and prescribe actually strong scheduled medications to help people detox. When it comes to BioCor, we can do our evaluations online, whereas my patients would have had to have flown from around the country to come see me. I can actually see them start the process there. Obviously, the final process is a surgical process. I can't do that over the internet, not yet. That's coming, though, and some surgeries are done robotically. But as far as BioCor, we haven't been able to do that yet. So eventually, the patients will have to come to me. But to get the process started and get them started on the medication, that it's the core of the BioCor program, we can get that going almost immediately, which is phenomenal. We weren't able to do that a year ago.
Yeah, thanks for the input so far, and certainly a lot to look forward to. As you had mentioned today, we are with Dr. Joseph Desanto, an addiction specialist with BioCorRx Inc., an addiction treatment solutions company targeting substance use and other related disorders. He's joined us here today on eHealth Radio's Addiction Prevention and Health News channels, a part of the eHealth Radio Network. Now tell us, Dr. Desanto, what makes the Beat Addiction recovery program unique?
Well, at the core of the BeatAddiction.com program, also known as BioCorRx, is the surgical procedure of the implantation of the medication known as naltrexone. Now, naltrexone, also known as Revia, that's the brand name. We use a generic compounded form that is said to be FDA approved, which is extremely unusual. The implant version is not FDA approved in the country, and neither is the procedure. But the procedure has been very successful. It's been successful around the world, and we've been using it in this country for the past almost 30 years now. And the success rate is due to its inability to not have that medication in your system every day. So naltrexone could be taken by mouth by an individual, but it relies on that person to take that medication by mouth every morning. Now, naltrexone is an opioid receptor blocker. And what that does is it reduces cravings in patients who suffer from alcoholism, and it reduces the opioid effect, completely blocks the opioid effect, in fact, of any opioid abuser that will try to abuse opiates. So it gives them that added protection and that blockade in case they do decide that they want to relapse. So it's twofold. It's knowing that you can't use, and if you do drink, you won't feel the effect of the alcohol as much, and you're reducing cravings for both opioids and alcohol. So we use it in both disorders.
You know, earlier we talked about the effects of COVID-19 on an addict. With the winter holidays approaching quickly, why are addicts more likely to relapse during this time?
Well, I'll tell you, even without the COVID lockdown and the COVID quarantines around the country, and it's specifically stringent in California, addicts and alcoholics don't do well around the holiday times. Typically, our addicts and alcoholics have had a history of, let's put it this way, not bringing the best of themselves to the holiday period. They typically had not very good holidays growing up, or recent holidays that weren't very providing good memories. So they're not looking forward to the pressure of having to be present during the holidays. They're not looking forward to being around. Let's just put it that way. It's stressful on someone who doesn't have a use disorder. You know, we have to show up. We have to be our best. We have to provide joy and memories for other people. When you're an addict or an alcoholic and you're a disease, that is the last thing that you want to do. And the pressure of the holidays coming up in the months that precede holidays is not a very good time. I see in my practice an increase in relapses of both alcohol and opiates, of all drugs, in fact. And unfortunately, the suicide rate actually goes down during the holiday period, which is a fact that surprises most people. But the time that leads up to the holiday period is usually one of worry and concern for someone who is struggling with alcohol or drugs. So now's a really good time to reach out. And I spoke about the overdose rates this year. I think in this country, 270,000 people have died from COVID. What we're not talking about is the 150 to almost 200,000 people that may have died from suicides or overdoses due to the lockdown as well, that would not have, we wouldn't have lost them otherwise. So these numbers need to be taken into consideration when we're considering such stringent lockdowns.
Interesting enough, I actually mentioned to my wife this week, I wonder how many suicides have occurred during or within COVID-19 lockdowns. And you hit on it right there. Good point made, no doubt. Now, also, how can family members help loved ones get help and navigate their addiction during these unprecedented times? Talk to us about that.
Well, we're trying to make it as easy as possible for families, bringing information to them. The more informed you are, the more choices you have when it comes time to make a decision. The biggest problem is that a family member will look at another family member and they've got say their child is suffering from addiction. They don't know where to go. That's typically the first step that blocks them from seeking help. So the knowledge to know that you've got so many opportunities, so many choices. There are doctors around the country that specialize in addiction medicine. In my clinic in Costa Mesa, California, that's all I do. I specialize in addiction medicine. I see addicts and alcoholics all day. You don't think it sounds interesting, but it's extremely interesting. They're the most interesting group of people. But my problem is getting my information to people that need it. I don't advertise. It's word of mouth. So I try to get my information out, and I try to get the BioCor program information out to people, because this is a step. These are medications that we know save lives. We know it stops people from using and drinking in at least the first 90 days of their attempted sobriety, and if at the very least reduces the number of drinks and number of times they potentially do relapse. So if I can do anything, and it's not necessarily get the information of the BioCor program out, but get the information of the practice of addiction medicine, and that there are specialists for this, just like there's a specialist for your heart and for your liver. I mean, there are doctors that train now in fellowships that have 3-4 years of formal training. They've got to go through hospitals like any other intern or resident, and that's all they specialize in. So it's extremely specialized. It's a specific language that very few doctors possess, how to speak to someone who has an addiction or alcoholism, and it's something that it's not necessarily advertised as an addiction specialist. They're usually under different specialties. So you have to do a little bit more research and a little bit more homework to find the addiction doctor. And it's a board specialty now, which is just that's unfortunately been a recent thing. It should have been happening a long time ago. You figure the Betty Ford Center has been around since the 70s. The specialty of addiction medicine has been around maybe half that time.
Certainly some interesting and insightful information shared here today, and really timely to be able to get this information out, and thanks for your time and coming out to be with us here today. In conclusion, and as we conclude, any closing thoughts, a final word, or one tip or anything else you'd like to mention along the lines of our conversation today?
Yes, and thank you for having me, Eric. It's been an amazing year as far as the ability to reach people. But I don't think enough people know that they could take advantage of this. Please take advantage of this time. It's unprecedented in many ways in history. And remember that when we lock people down, there's going to be results that we have not yet predicted. And I fear that we may be a little overzealous. But know that there are medications that help. BioCorRx is a group that's trying to bring this to the United States, to the public, through addiction specialists that are available for you at an unprecedented rate and possibilities across state lines, and we have the ability to prescribe medications that could save lives. So please reach out if you can.
And of course, we certainly are appreciative of what you're doing in the space through BioCorRx Inc. And speaking of which, where can listeners get more information online, and how can they best be in touch as well?
You can reach on the internet, beataddiction.com, beataddiction.com, and my clinic is DesantoClinics.com. And I'm in Costa Mesa. If you're in Southern California, you're local, stop by.
And certainly appreciate that invitation. Again, listeners, it is beataddiction.com. Dr. Desanto, all the best, and thanks for joining us here today on eHealth Radio.
Thanks for having me.
It certainly was our pleasure. We've been speaking with Dr. Joseph Desanto, an addiction specialist with BioCorRx Inc., an addiction treatment solutions company targeting substance use and other related disorders. And for all the details, once again, visit beataddiction.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.